Well, I saw this story this morning, and it's interesting because it didn't appear in a local paper here. It appeared in the Globe and Mail, a national story talking about Quebec and private health care and how we are losing doctors at a record pace. When I say losing, I mean leaving the public system to go into the private system. The numbers, by the way, are pretty staggering when you compare what's happening in Quebec with any other province in this country.
Yeah, there's a reason for that.
I'm thinking there's lots of reasons
Uh-huh.
for it, but let's find out. Olivier Jacques is an assistant professor in the Department of Health at the University of Montreal. He's on the line right now. Olivier, thanks for being here this afternoon.
Thanks for having me.
You saw the article, and I guess my first question would be, why is there such a huge discrepancy between people who leave the public system here as doctors and the rest of Canada?
Also, there are fewer requirements asked for a doctor who want to leave the public system. It's relatively easy for them to do, and there are more requirements in other provinces. For example, you really can't continue to practice in any way in the public sector and being in the private sector in many provinces. And at the same time, we are asking more of doctors, especially of young doctors. For example, with the activité médicale particulière, where we're requiring them to go to the hospital, to practice in the hospital, and we are allocating them towards certain regions. So it's easier to go to private, and the public system has more requirements, so they ask you more.
Yeah, and beyond the numbers, by the way, the other thing that I got from the story was they are also doing this sooner than, it's not as if doctors are retiring and deciding to go private necessarily. You have graduating students working in the public sector for just a little bit and then saying, hey, the hell with this, and they leave. So we're seeing that more than we've ever seen before.
Yeah, and so I think this story really reveals us that it's not true that we have a totally public system without any private system. We have actually a private system that is already quite developed and that is already causing problems on the public system. So I think we need to keep that in the background.
Okay, so when we talk about the problems that it's causing in the public system, is it simply a lack of doctors, or does it go beyond that, Olivier?
Well, so these doctors that go in the private system, they don't exist in the public system anymore. It's not as if having this alternative private system increases human resources in the overall system. No, it's that they go in the private system and then they can more easily choose patients. It's more often than not easier cases because you need to pay to go there. And several of the most vulnerable population cannot afford to go to the private system and have often more health problems. So it's better pay for less work.
What about this argument that somehow allowing so many people to access or having so many people access private healthcare eases the pressure on public healthcare and actually makes it more accessible to others?
I mean, it would be true if it increases the total amount of human resources in healthcare. But the fact is that it's not because you have a private sector that you will have more nurses and more doctors in total. It's just the same people that rather than working in the public sector, they work in the private sector. So that argument would be true if it increases, if it makes more people decide to become doctors or nurses. But we really don't have actually a problem of amount of nurse or doctor per 100,000 people. We actually have the highest number that we've ever had right now of doctors and nurses in Quebec.
But they're choosing to opt out of the public system to go private.
Well, we also indeed have the highest number ever of doctors that are opting out and going in the private sector. But overall, we're still having more doctors than we ever had as a proportion of the population.
Okay, so let me ask something. The government has made a lot of noise of late addressing this whole issue of private health care. I think the health minister came out and said this idea of the private nurses, of course, to supplement the situation in hospitals now, which is tenuous at the best of times. They're going to do something in terms of that, legislate it somehow. What is that decision? Do you know?
So are you talking about the new private hospitals that they want to create?
So they're setting up those private hospitals. Well, what about nurses who just opt to go into the private system, right, and work within that private system? Is the government going to limit that number?
I mean, I believe they should, but are they going to do it? I don't know, because there's this idea that maybe the private sector can be more efficient. And, if we're just thinking about private delivery of services, I mean, it's not impossible that a private hospital could be efficient. The issue is that it's very important to regulate it and also to make sure that people can access the private services with the RAMQ without having to pay. Because now what we're talking about is doctors that are completely out of the system,
Right.
and you need to pay to see them. This is actual privatization.
I have to say, I don't understand why a doctor right now would choose to go public rather than private, especially when the Prem dictates where you can work, where you can practice. So would doing away with the Prem have more doctors choose to opt into the public sector?
That's an important dilemma, because the problem is still that the Prem is useful to make sure that you have doctors in all the regions, and also we need to keep in mind that these doctors are benefiting from very, very low tuition fees, and at the same time very, very high salaries. So they kind of have to give back to society and accept to go in some regions. And let's be honest, like a doctor that goes to a region, it's quite a good situation. He's going to be able to buy a house at like $150,000, and is going to still earn this $200,000, $300,000, $400,000 a year. So it's not that bad to go to the countryside for some of them. The other solution would just be to prevent to make it illegal to go in the private sector. That may be actually easier and would not create a problem, which would be that you wouldn't have enough doctors in some regions.
So I want to make sure I understood what you said a minute ago, which was we always hear the story about 1 million people almost waiting to find a family physician. You're saying we have enough doctors?
Well, I'm not saying we have enough doctors. We have more doctors than we ever had. And actually, if you compare Quebec to other provinces, the numbers are fine in terms of the amount of doctors we have. The thing is that doctors have fewer patients on average and work less on average.
Okay.
And as we increase doctors' salary, they just started to work less because, at some point, if you're earning $300,000 a year, why work 40 hours? If you can earn $300 a year at $300,000 and work 34 hours, let's say. So that there's this, but also like the issue is also that your access to primary care doesn't necessarily need to be only geared towards doctor. I think we have a problem of we don't have enough des infirmières praticiennes spécialisées, the nurses that have master's degree that could do a very similar job and ease our access to primary care.
Nurse practitioners, yeah.
Mm-hmm.
So this is something clearly the government is going to be facing. This question is going to come up, I guess. We shall see what they are. What are you expecting the government to do, just as a final question? You think anything will change? Is there something you think they're going to do right away?
It's very difficult to think the government's goal is always to control costs and maximize access. This is every government's goal, but it's very difficult to force doctors to do things, and it leads to unintended consequences. So I don't really know what's going to happen, but definitely that the government is going to continue, and what they're doing is to try to increase access to primary care by making sure that nurses, pharmacists can do more prescriptions and more acts that are normally just given to doctors.
Mm-hmm.
Olivier, I want to thank you. I wish we had more time. I want to thank you so much for the time this afternoon. We appreciate it.
Oh, thank you very much.
Yeah.
Have a good day.
Sure, you too. Olivier Jacques over at the University of Montréal. Makes some interesting points. I didn't know that, right? But it makes sense.
Makes a ton of sense.
You're paying the doctor that much money to go somewhere else, so now you're offering him more. Why would you take on a longer work week to see more patients when you can make the same amount of money?